Hi, everybody. It's Dominic from the MS Guide. And today I'm really thrilled that we've got a really special guest all the way from the US. He's made time very early in the morning. It's Dr. Barry Singer. So Barry, tell us a bit about yourself, please.
Oh, thanks, Dom. Thanks for having me on the MS Guide. I'm a director of an MS center. I'm in St. Louis, Missouri, and run a comprehensive MS center. We are one of the largest regional MS centers in the Midwest. And so we do comprehensive MS care as well as clinical trials and clinical research. Been in the field of MS for about 27 years and been involved in over 35 clinical trials. I'm on the board of directors of the Multiple Sclerosis Association of America and started MS Living Well for patients living with MS in 2007, which has been a resource in 200 countries, and the MS Living Well podcast host.
Hey, that's pretty cool. I've listened to the podcast as well. And just in case anybody's wondering, I will put all the links in the video description so you can go and listen to Barry's podcast, because the benefit over YouTube is you can take it with you while you're doing something else. So I'm a single MS patient. I'll speak to other single MS patients. You oversee essentially 4,000 roughly. I was really interested to know from a doctor's perspective, Barry, if you could wave your magic wand and say, I don't know, forget vaccines for a sec, what are the top 3 things that you see people either doing or not doing that could make their lives measurably better, perhaps reduce the severity of their MS? I don't know how you put it, but
I think the biggest concern is getting diagnosed as soon as we can. I still see a delay between first symptom and initiation of treatment. Even in the past week, I saw 2 patients where literally for 10 years they were not on treatment. And now they have all these lesions in the brain and spinal cord, and we're behind the 8 ball. So sometimes with symptoms and people don't advocate as much, or the GP just kind of pushes it off and writes it off to another
family
symptom.
doctor, isn't it? A GP in UK is a family doctor in the States?
Family doctor. Yeah, family doctor or something. So if something's wrong, I think you really have to advocate. Some of the first symptoms of MS would be one's called Lemaitre's line. When you bend your head down, you get electric shock sensations down your spine. Ding, ding, ding. I hit that one, huh?
Exactly.
Ooh, that was a pretty good,
yeah, you
pretty good swing there.
And yeah. I said, they said, what's it like? I said, it's like I licked my fingers and stuck them in the plug.
Yeah, exactly.
Pain. It was astonishing, but yeah.
Yeah, numbness in the feet, and it sends up the legs. A lot of my patients had fatigue for 2-3 years before they, developed symptoms, vertigo. So if you're having symptoms and it's unusual, then it needs to be evaluated. And I think sometimes it's persistence. A lot of times, it resolves. By the time you get into the doctor, it's gone. So forget it.
It was completely gone, Barry. The only reason I went to the doctor was one of my mates was a doctor, and we were sitting there at a barbecue, and I said, gee, Charlotte, something odd's happening. And she said, wait a month and then go to your doctor. And it had gone, but I still went because it still happened occasionally. And he went, oh, and that was that. But yeah. I was so lucky that somebody did. I didn't advocate for myself. I didn't know. I probably would have left it. And so, okay, so if that's number 1, people don't advocate for themselves enough, or people don't take things seriously enough. What we say is number 2 that you would wish people would do?
Adherence. So take their medication. So I think taking the medication is really, really very important. The patients that have done well, and I've been in practice now since literally 1999, and I have some patients from then. So we're going out like 22 years together. And some of my patients are living full lives with no significant disability, and they got on the treatment early and they consistently took the medication. So that's the key, is to control that new MRI activity, relapses, prevent progression to disability, keep your brain volume plump. So as we age, our brains are shrinking. This happens faster in MS, but on treatment, we can help prevent that. So I think that's really, really critical, is to really stick with the plan. Back in the day, it was hard, if if you were doing the shots. So, some people do great with interferon shots and some people do great with Copaxone glutaramine acetate shots, but other people it was tough. And so we saw a lot of people dropping off. But with all the oral medications out now and the IVs and the infrequent injections, we have an array of options. So you should be able to tolerate your medication well and have good quality of life without a lot of side effects. So I think that's the key. So the people that when we crush this thing, shut it down early, patients do well. And I think that's the name of the game for the most part. And
I have been diagnosed at 28 years and I rarely missed anything. I was on beta-interferon, I was on Copaxone, I was on Tecfidera, now I'm on ocrelizumab, which is kind of nice because you don't miss it really. And I exercise my backside off because it's kind of like what I'm doing. But after 28 years, I'm very lucky, I think.
Yeah, that's really great. That's
Yeah.
really great.
But last thing, what would be your, so we've got recognize your symptoms or advocate for yourself, take your medication and really stick to it. And I would say to people as a patient, if you can't stick to it, stick your hand up and tell them, because there are so many other choices. Your doctors and nurses will help you out with another drug. And what's the third one?
I think the most important one, and actually it was my first podcast with, and Dr. Boster was my guest, and Heidi Creighton. And so we talked about don't underestimate the disease. So, winning strategies in MS require careful approach. I think that's where an MS expert really comes in handy when you're trying to figure that out. So you want to look at, what are your risks for getting worse? We know some people are at higher risk. For example, if you have a lot of lesions on your first scan, actually later, if you get MS later in life, let's say 40 plus, you're at higher risk to go on to develop disability sooner. If you have incomplete recovery from your first attack, you have lots of relapses the first couple of years. So those are people at higher risk. We also know men tend to do worse. In the US, African-American patients do worse. And so we start to figure out who's going to be at higher risk. And then we have to think about you in terms of your willingness to accept risk. And how much risk are you willing to accept to control the disease? But in general, patients that are on higher powered drugs tend to do better long term. But we can kind of figure that out depending on where you are with your disease spectrum. But we don't want to underestimate the disease. If we underestimate the disease, then you'll live with disability later in life. And what I don't think about a patient that day. So if someone comes in, they're 32 in my office, I'm thinking about how are they going to be when they're 55, 60? Yeah. Are they still going to be able to work? Are they going to be on disability? Are they going to be able to get on their floor and play with the grandchildren one day? So I'm always thinking long-term about how I'm going to protect that person's nervous system.
Barry, look, I really appreciate your time. I know that you're pressed. I know you're a busy guy. So I thank you so much for coming on the msguide.com and just sharing some of your views with us.
Well, thanks, Dom. I appreciate the ability to connect. It's good to see you virtually in this context, and hopefully we'll get together in the UK sometime soon.
Yeah, it's always one of these things now. If we could meet for a beer one day, that would be awesome.
It'll happen. It'll happen. All right, take care, everybody out there, and thanks for having me on the MS Guide.
Pleasure. Take care. Bye-bye.